So when it comes to facelift, I think one of the biggest misconceptions is that we're tightening the skin. In some of the older methods, tightening is kind of the way they went about it. Nowadays, we use what's called the deep plane facelift, and this is more of a release and reposition. And what I mean by this, let's take the analogy of a bed sheet. If I were to just pull that bed sheet tight as I can, smooth out all the wrinkles, that would be similar to what some of the skin only or SMAS repositioning facelifts were to do, whether it's be a lateral SMAS plication or some of the low high SMAS that really focus on the fixed non-mobile SMAS. Nowadays, we focus more on the mobile SMAS, which is the premise behind the deep plane, and essentially what we're doing is we're releasing the bed sheet, for example, the foot of the bed, sides of the bed, and then we're repositioning that sheet wherever we want and then smoothing it out. So there's no tension on this tissue, but we're moving it back to its more youthful state. And how we do so is we're really focusing on this mobile SMAS that is beyond where many of the previous facelift procedures were effective. And what we're doing is we're releasing some very important ligamentous structures. So for example, there's a cervical retaining ligament that really allows release of the neck muscles, the mandibular retaining ligament, which allows mobility and gets rid of some of this pre-jowl sulcus that we'll see, zygomatico-cutaneous ligaments, masseteric cutaneous ligaments. So these ligaments all limit mobility, and by releasing them, we're really able to remove the cheek, jaw, soft tissues, along with the platysma muscle of the neck, exactly where we want it, without tension, by repositioning after we release. And this provides a very natural but also long-lasting result. So if you have any more questions, feel free to DM me or drop a comment below.